Hello, my name is Belén Erazo. My topic is assessing children's risk for dental caries and parental preventive practice. Definition. This infectious disease is currently considered as a dysbiosis caused by the consumption of sugar. That is, it is considered to be a sugar-dependent disease. The following video is
Take a
explains
look
more.
inside your mouth at the big molar teeth in the back. You see those deep grooves on the tops and sides? That's one of the most common places for tooth decay or dental caries to begin. You can help prevent cavities from developing by brushing after meals and snacks at least twice daily for 2 full minutes. Try to cut back on sugary snacks, soda pop, and sports and energy drinks. Otherwise, what's going on in these teeth could happen to yours. If food deposits are allowed to stay in the pits and fissures of the teeth, bacterial acids and enzymes can dissolve away the enamel. Acids from food and drink can also directly dissolve enamel. Here's another place where bacterial plaque accumulates, on the sides of the teeth along the gums and between the teeth. That's why it's so important to brush the sides of our teeth as well as the tops, angling the bristle tips beneath the gums, and then flossing between the teeth every day to get rid of the fuzzy plaque. If it's allowed to remain between the teeth, you may develop cavities on the interproximal surfaces.
Applications in odontology. A healthy mouth and a healthy body go hand in hand. Professionals and other members of the dental home must be clear that tooth decay can be prevented with the joint action of both. Good oral hygiene, a reduction in the consumption of sugar in the diet, and a regular and adequate use of fluoride are key elements for effective caries prevention strategies.
It's been demonstrated in research over and over again that there's a link between the health of our mouth to the health of our rest of our body. So whether it's cavities or gum disease, there are certain systemic conditions like diabetes or heart disease, even pregnancy, that having untreated dental disease can impact those systemic conditions and actually make them worse.
Pay attention to prevention because that's less surgery, less times you need to get numb, less times a dentist needs to go and drill in your teeth. This is what we preach to our patients. We want them to cut the cycle, break the cycle of cavities, fillings. We want to actually teach you about strengthening your teeth, reducing your risk for getting cavities.
Cavity is a bacterial infection of the tooth. In order to actually get a cavity, you need to have 3 factors. You need to have bacteria, you need to have sugar, and then you need to have an area of the tooth that's already susceptible to disease. But there are ways in which that hygienists and dentists can identify early signs of disease and have those early signs reverse or prevent from growing. Caries risk assessment is the term that is used for the tool or the assessment in which dentists and hygienists can effectively identify the factors and behaviors that will lead to dental disease. By utilizing caries risk assessment, by utilizing a disease management approach in dentistry, it really sets us apart from many other providers because we really want to focus on prevention. We really want to educate patients and inform them on the ways in which that we never want to see a cavity again in you. We never want your child to have a cavity. We want you to be healthy, and using risk assessment is the way that we are able to do that.
Our goal, our focus is to help our patients in any way we can. And we found that education and disease management is the best way to help our patient overall.
The standard of care should be risk assessment for every single patient. The standard of care should not just be let's fill these teeth and fix it and that's it. It absolutely should be every patient deserves to have a preventive patient-specific plan as well as a restorative plan.
Having a treatment done at this office where we pay special attention to providing dental education, preventative care, evidence-based care is a great benefit to you because we are only going to do the necessary treatment that you require. We are also focused on decreasing your disease. You want to be better for longer. You want to spend less money, spend less time in a dental chair, and that is our benefit to you.
Pros and cons. Protective factors: everyday use of fluoridated toothpaste, daily use of low fluoride mouthwash concentration, use products with chlorhexidine, use groove sealers, carry out an effective and frequent tooth brushing. Risk factors: carcinogenic bacteria, absence or low production of saliva, bad habits or lifestyle such as eating frequent fermentable carbohydrates, and a poor oral hygiene.
Preventing tooth decay. Teaching your child good dental habits means more than just brushing teeth for fresh breath and a bright smile. Tooth decay is the most common chronic childhood disease, 5 times more common than asthma. But establishing good habits early on can help prevent it and the problems associated with it, like painful eating and trouble speaking. Preventing tooth decay is important for a child's overall quality of life, and it starts at birth. That's right, even before a baby has teeth. Here are some ways to help your child prevent tooth decay. As soon as your baby is born, begin cleaning your newborn's gums with a soft, damp washcloth or silicone brush after feedings. Use only formula or milk in your baby's bottle. Juice and other sweet beverages contain too much sugar that can coat your baby's mouth and gums. Also, avoid putting your baby to bed with a bottle. You may be tempted to clean your baby's pacifier or spoon by placing it in your mouth, but doing so can transfer harmful bacteria to your baby. Before turning 1, your child should have her first visit to the dentist to check for any early problems. As your child grows to be a toddler, teach the healthy habit of brushing teeth twice a day and schedule dental visits twice a year.
Until your child can spit, you want to use a fluoride-free toothpaste. And then once your child is able to spit, what you want to do is you want to switch over to a fluoride toothpaste, but you want to use just a pea-size amount so that they're not getting too much. And then you're going to want to help your child with their brushing. So you're going to want to help with getting those back teeth, making sure everything is nice and clean. And what we recommend is brushing at least twice a day, in the morning and then right before they go to bed.
You brush your teeth. When you wake up in the morning, it's for...
Make brushing teeth fun and effective by playing a 2-minute song and telling your child to brush until the end of it.
Issue update in Ecuador. The best way to control early childhood cavities is education to parents or caregivers before the first year of life, with the aim of that they value the importance of maintaining good oral health in children. Education for health has 4 fundamental objectives: get people well informed about health problems and illness, get them to adopt health as a fundamental value, modify unhealthy habits or behaviors, promote appropriate health behaviors. And finally, conclusion. The most influential risk factors for cavities are the accumulation of bacterial plaque, carbohydrate consumption for daily. Therefore, it is recommended to carry out strategies at the school level that promote a balanced diet in order to reduce the consumption of carbohydrates and the number of sugar foods and drinks. On the other hand, greater emphasis should be placed on the responsibility of parents, caregivers, and or guardians regarding the oral health of minors. Through the implementation of promotion and prevention services that include different strategies for the use of fluoride toothpaste, brushing techniques and frequencies, as well as regular visits to the dentist. Thanks.